The more challenging things that surgical technology students have to learn is all the instruments that go along with all the surgeries. There are hundreds and hundreds of instruments that, as a surgical technology student, you're going to have to learn. Today, I'm just going to cover the 50 or so most basic instruments, those instruments that are going to be used in many different surgeries. So we consider these the basic instruments, and we're just going to go very briefly through them, give you a quick introduction to each of these instruments and how they're used. So probably one of the most commonly used items is going to be the BOVI, or the electrosurgical unit. Now this is the handpiece that comes. This is a disposable unit. It is attached to a giant contraption. We call it the BOVI, or the electrical surgical unit, that actually powers this. Now the electrosurgical unit is used to provide a little jolt of electricity to the tissue that we're working on. Now it can do one of two things. One, it can cut the tissue. Basically what it's going to do is that electricity is going to cause that tissue to get so hot it vaporizes away and it causes it to cut through that tissue. And or it can cause it to coagulate. Now what this means is you're going to take that tissue, heat it up a little bit in a specific way. It's going to cause the proteins in that tissue to sort of liquefy a little bit and then come together, to congeal together, to coagulate, and that's going to seal off any little blood vessels in that area, and it's going to cause the bleeding, any bleeding that might be in that area, to stop. So we use the electrocautery unit, and the electrocautery pencil in this case, to touch where we want to either cut or coagulate, to stop bleeding in the wound. This is used in conjunction with a grounding pad that we're going to place elsewhere on the patient. This is going to complete the circuit so that we have an electrical circuit that runs from the tip of this ESU pencil through the grounding pad and then back to the power unit itself. The electrodes itself, the tips of these pencils, are interchangeable. So this is a standard one. Now with this one, what will happen is as you're burning through or coagulating the tissue, some of it can sort of stick to the end of it. It gets kind of charred a little bit. You have to brush it off. Or you can swap it out with a Teflon coated tip, and this Teflon coated tip is nice and slippery, so you can just sort of wipe, using a Raytec, you can wipe any charred tissue that might be stuck on there off. These also come in different sizes. You can come with the really long ones that'll help you get nice and deep into a deeper wound. So these longer ESU tips are possible as well. Now another way of cutting and coagulating tissue is using a harmonic scalpel. This guy's kind of fancy. This thing plugs into a power source, and what it does is it uses electricity to create a very high frequency ultrasonic vibration in this piece that runs down the length here. So at this end, we're not using electricity at this end. At this end, one of the pieces is vibrating very quickly against the other piece. So it's sort of doing this. It's vibrating very quickly. It's creating a lot of friction. That friction then creates heat, and it cuts through and coagulates the tissue. So when we close down on this, you can see the one end is going to vibrate very, very quickly. The other end squeezes that, and as it does, it creates that friction in there that's going to cut and coagulate any tissue that we happen to clamp through this. But when it comes to clamps, there are many different types of clamps. These are small clamps. We call these mosquitoes. The technical name is the Halstead clamp. There is a curved and there is a straight version of the mosquito clamp. So it's just a small hemostat. Now the curved version, usually you're going to use curved versions of these instruments on tissue. So if you have a very small bleeder or something like that, you can clamp that, and that's going to stop the bleeding. Now the straight versions are usually used on things like dressings or suture. In fact, you can get these little suture